Hi, I'm Dr. Adam Raben. I'm chairman of radiation oncology at the Helen F. Graham Cancer Center at Christiana Care Hospital in Delaware. Through my experience, I've learned two things that have begun to make a big impact on my practice. Whether you're educated or not, whatever background you come from, the diagnosis of cancer, as you know, is extremely disheartening. When introducing the possibility of treatments, I've learned that, number one, a significant proportion of our patient population, irrespective of their background, are healthcare illiterate. The second thing I've learned is that when you combine that with the fact that when you speak to a patient and they walk out of the consultation suite, the reality is that they do not retain about 80% of what you tell them. So I started to look carefully about how we can improve performance, because even in our world of technology, sometimes it comes down to simple improvements in performance by how we communicate to our patients and giving them an opportunity to be more engaged in what we do. And so I started working with a company by the name of 5thPort to improve patient engagement, patient education, patient satisfaction. It really allows for patients to open this 5thPort link that is completely categorized by the type of cancer they have. For instance, if they have breast cancer, this would be a breast cancer link that allows them to begin the process through an active video, as well as teach back question tools that basically solidify their understanding of their future treatment in radiation therapy. It documents that through a digital signature that allows us to then immediately zero in on areas that they didn't understand. We are finding that this may in fact improve our nursing engagement with our patients, because many of our nurses are stressed, they're overworked, we're understaffed, and so this is a neat tool of improving caregiver experience as well as the patient experience. What I like about this software in particular is that it offers analytic tools on the back end for us to determine actual patient satisfaction. From what I have seen in some of the data, this has resulted in a significant and dramatic improvement in patient understanding of their disease, the actual treatment. And I think this really bridges the gap between patient expectation and physician expectation, and finally the potential outcomes, without significant misunderstanding. Even though Astro has had a library of films and different teaching tools, they're really not used to the extent that we would hope that they would be, even in our clinic. I think this is an opportunity to engage Astro with this product that might distribute their very educational videos to a wider audience, but in a different kind of setting rather than in the doctor's office. Astro is incredibly important to this process. Having Astro get involved in improving these disparities in understanding and improving patient education and engagement, I think is the model for how a cooperative society within radiation oncology should move towards. I hope this is the beginning of an adoption of a better way of communicating with our patients and making them feel really more empowered about what's happening with them.